Hey, Kua.
Hey, Kendra.
So we are on episode 2.
We're back. Episode 2.
Yes, we missed you
Season 4.
Season 4. We missed you last week, but it's okay. We're back and reunited.
Hey, and it feels so good.
See, you and the singing.
We're ready.
All right. I'm sorry. We got to get our mojo back, y'all. But we're season 4. We have some phenomenal guests like always.
Yes.
We have one today, which we'll have her introduce herself in a moment. But I'll have actually Kua introduce Shannon because y'all go a little bit back.
We go a little bit back, Shannon.
Definitely.
You know, we were at the same organization for a little bit before Shannon moved on to different roles, doing amazing work. So Shannon is the Chief Diversity and Inclusion Officer at Kaleida Health here in Buffalo, New York. Shannon has been in the learning and development space for a very long time before she got into the DEI space. Care coordination, you did direct services with patients, clinical, I can go on and on. You know, Shannon is amazing. So we're super excited to have you on the podcast today. Welcome.
Thank you. I'm so happy to be here.
We've been talking about this for a little bit too,
We
right?
have,
Yeah,
we
we
have,
have.
because, you know, we always said we have to create our own little circle in DEI space. So we hang out all the
Absolutely.
time and we talk about so many great hot topics
Yeah.
and issues within our own community. So it's just great to have you on the pod to talk to the
Yeah.
people about it.
I can't wait to talk with all of you.
So can you introduce yourself for everyone who's listening?
Yeah. So I'm Shannon Bryant, Chief Diversity and Inclusion Officer for Kaleida Health. I am happy to be on the podcast. We'll be talking about healthcare, of course, and all of the things that impact marginalized communities, especially in Western New York, where we are trying to make some real changes.
Absolutely.
We want to save some lives. So.
Yeah.
Yes, all about saving lives.
Right. So we are going to dive right in as usual, right? This is the Black Gems Dive In podcast.
Yes.
So we're going to dive into the hot topic today. And I know Kendra was back last week,
Yes.
but we're going to, we got to get back into the swing of things,
do.
right? So the hot topic this week, we're actually going to talk a little bit about Roe v. Wade being overturned because, we took a little bit of a break on our podcast, coming back to chat with the people. But we haven't had an opportunity to talk about Roe v. Wade, some of the implications that have happened since this has been overturned and what that looks like us moving forward in a post-Roe v. Wade world. So in June of this year, we know that it was historic. It was a far-reaching decision. And honestly, it was leaked prior to it actually being overturned. But the Supreme Court officially reversed Roe v. Wade, declaring that the constitutional right to abortion that was upheld for nearly a half a century no longer exists. Justice Samuel Alito was writing for the court majority, and he said that the 1973 Roe v. Wade ruling and repeated subsequent high court decision reaffirmed that it must be overruled because it was egregiously wrong. The arguments made were talking about how it was damaging and it was an abuse of judicial authority. And essentially, they were moving this decision from a federal level back to the states to make that decision. So what do we know about some of the states that have talked about this and have reversed? Because immediately some of those were reversed. Others, it's been taking some time for them to get this in motion. But where are we at?
Yeah, and I know a lot of companies, even in states where they said that they're going to uphold this law, there are a lot of companies who are saying that they're still going to protect women within their own healthcare benefits that they have for the companies, providing care in different states if they have to. But again, that coordination care, we know, gets really sticky and muddy at the end of the day. So we do see a response in terms of corporate responsibility and what that looks like as well to its employees. But we know that this is also a topic that's going to be at the forefront of election season as well.
Absolutely.
So this is something that's not going away. So there's so many conversations about it. And Shannon, what are you guys talking about at Kaleida, and what does that look like for you guys?
Yeah, so this is an interesting conversation for us. We truthfully were devastated by the news because we know that we're lucky to live in a state where it will be protected, but we also know a lot about the maternal mortality. And I know we'll get more into that a little bit later, but in New York City, Black and brown birthing people are approximately 8 times more likely to die in childbirth than their white counterparts. And that right there tells us something. We see the same trend across the U.S., right? So it's not just specific to New York City. We see 3 to 4 times more likely, even higher in other places. So because of that, what's going to happen is we know Black and brown birthing people are going to die. That's what's at the tail end of it. So for us, we've been talking about how do we continue to educate our patients on what is available to them, letting them know, where they can go for services, reminding also our employees that that doesn't change, anything that we've been doing.
Right.
So it was important that our leaders spoke out about that. So we do have our site president spoke, and at Children's and as well as at Suburban and Buffalo General. They all felt really it important for them to say something as far as respecting the woman's choice. So that's what we've been talking about, and really just how can we advocate on a bigger scale, because it will impact a lot of other people.
Yeah. And I think we've seen that subsequently after it being overturned, there's a lot of conversations that are happening, across the nation where the states that immediately enacted the abortion bans were seeing some of the healthcare implications that are happening afterwards.
Right.
So, people often talk about abortion being healthcare, right? And a piece of healthcare, there being different types of, conditions that people are in, and that's the reason why they would need an abortion. But now we're seeing where there are doctors who are reluctant to provide that specific type of care because essentially the law states that you can't do that. Yeah. And so, it's interesting to look at it from that healthcare lens and healthcare perspective, because obviously there's been a lot of conversations on the political side, the religious side, and what that might look like. But in the healthcare field and realm, it's a different conversation that's being had for sure.
Yeah. And we'll dive into maternal health and what that looks like for birth rates and things like that, specifically in your job. I know you added a new person to your staff, so we'll talk about that and what that means. So I guess we'll just dive right into our conversation.
Yes, let's do it.
So Shannon, what does your day-to-day look like at Kaleida? Because you are the first, let me say this,
Yeah.
the first
Thank
CDIO for Kaleida. So
Yes.
Congratulations on that.
Thank you.
But what does that look like for you? What is that meaning behind that title, and what does your day-to-day look like?
So I'm glad that you point out it's the first, because so I've been there in November. It'll be 2 years.
Time flew by. You probably don't think it did, but it flew. I remember when you got that position.
It did. So I started at the end of 2020, and when I started, we focused a lot internally. The day-to-day was really like, okay, let's talk to employees. Let's tell them what diversity, equity, and inclusion even means, introduce myself, listen to, just some of their thoughts around DE&I, get a pulse, and I spent a lot of time doing that in that first year. So I had education that needed to be built, and employee resource groups, and mentorship. It was internally focused, really, because it was such an inaugural position. And I think with the timing of when I started, it was important that I had a pulse on like what people really felt about DE&I and healthcare. And so trying to draw those links so that they understood it more to be kind of like quality, where it's everybody's job. Yes, there's a quality department and they're going to drive the initiatives, and DE&I is the same way. I'm going to drive those initiatives and strategic plan, but everybody has to own a piece of that. So I think I'm still on the journey of getting people to understand that ownership piece. But I think it helped that I report to the CEO, and that journey started at the top of the house. So that helped certainly to drive initiatives and get buy-in. Well, fast forward a little bit, and what my day-to-day looks like now is more around data. So we've been trying to get our baseline. These are not things that the health system previously had been tracking or paying attention to as it relates to diversity, equity, and inclusion data on the employee side or on the patient side. So thinking of like who would I need on my team? How would we kind of start to chart a path forward with our data? I hired a DE&I data analyst, and she's been great. She's actually from Little Rock, Arkansas, and had been doing analyst work at Arkansas Children's Hospital. So she came with a wealth of knowledge, which was also a plus for us. So in that time, we have decided what are those employee metrics that we're going to focus on from a DE&I standpoint. And we really started with recruitment, looking at our recruitment pools and where people get stuck in the process and all of those sorts of things, comparing it to, what are the populations that we serve? How do we make sure our employee population is matching our patient population? But really starting at the senior level. That was, it's a smaller group for us to start with, but it's also an impactful group. So that's what we've been focused on the employee side. And then on the patient side, really looking at what data do we already have around readmissions, around discharge, and starting to disaggregate that data by race, ethnicity, age, generation, and language. So we already have some of that in our system, but it doesn't all feed that way right now. So we have our first iteration of our DE&I dashboard available. And I say it's the first iteration because it truly is. It's going to have to go through many forms before people can really know how to act around the data and really do plans around it. Yeah. So day to day, it could be employee patient focused. Another person on my team handles our employee resource groups, our manager position. So we have a lot of, again, figuring out the internal landscape. That person focuses on those things. And then we have our birth equity coordinator, who's the RN position, which focuses on our maternal mortality and really improving everything that we see as far as disparities with Black birthing people.
So I think, you just listed off three different roles. Number one, you've been in that role for 2 years. So first of all, congratulations on everything you've been able to accomplish so far. But it's an exciting time. I know we often talk about using data to make informed decisions based off of what the data tells us. And so I think, as long as we keep that in mind, the inward piece I think is really important too, looking inward as well as external as well. But I think that internal lens gives you a lot of insight in terms of what next steps you might need to take. So it's awesome. It's awesome to hear that. It is.
It is.
And I love the fact that you said that, obviously working in healthcare, you focus on quality. You both work in healthcare. Quality is that main piece. But having DEI be a part of a quality metric as well is really important. And being that you're the first in this position, really honing in on the quality piece of things, how are you making sure that people are bought into that? And because that's a new concept for a lot of people.
Question.
So how does that work for you?
So I think I've been pretty fortunate in that the early adopters, when I first got to Kaleida Health, were the physicians. They were the most excited that I was there. Awesome. They would come to my office, bring articles like, oh, you have to look at this. Look at how we're doing this. I think this is wrong. Or what about this idea? And so I think having them as champions has really helped to bridge that quality piece with DE&I. And I also participate. We have steering councils throughout the system, and I participate on all of the quality steering councils. Awesome. So a lot of times I'm the voice saying, have we thought about it from these different diversity identifiers? This year, one of the other projects that we embarked on was a SOGI data project. So for sexual orientation and gender identity data, we do not have that in our system to date. We are in the design phase of making sure that is there. So our clinicians, they understand it because they're the ones who are misgendering people. They're the ones who are not getting it right because their technology is not really helping them to do it. So they're writing me letters, could you please push this more? And I'm I'm going as quick as I can. It's an IT game at the end of the day too. So that has really allowed me to best tie quality to DE&I. And I think the quality piece really goes to our equity piece, right?
Absolutely.
You can't have true health equity if you don't have DE&I at the front of it. It's just not going to be possible. And I'll say another thing I think that helps is probably our regulatory bodies, right? So CMS, the Center for Medicaid Services, and the Joint Commission, and AHA, and I mean, there's so many that are now requiring that of healthcare systems that they would have a health equity measure. And that measure, if you're not meeting it, you don't get the same quality scores that you used to. So that had already been on the horizon, and I think just like the physicians and the clinical teams had heard about that. So when I speak to it, I'm speaking from a place of regulations a lot of times, like, you know,
Which
even
people
if
pay attention
right,
to.
right, if you don't personally buy into this, just know that this is a regulation that we have to meet at the end of the day. So how are we going to get there?
So I think it's interesting. You mentioned SOGI data, and coming from, you know, the organization that, you know, that I work for, you used to work for, that's something that we talked a lot about, right?
Right.
Can you just share, like, our listeners might not understand, what's the importance in understanding someone's sexual orientation or gender identity? What is the importance in knowing that, and how does that impact decisions that you're making at the healthcare table as well?
Yeah. I mean, it impacts a lot. So there's the basic level of respect, right? Like, you need to be able to respect people, calling them their correct pronouns, and really thinking of it from the sense of our name is the first thing that we learn as people, right? So if you're getting that wrong and then you're not allowing the person to educate you, that already is just like not going to be a good setup. It's not going to be a good relationship. But we know, similar to talking about Black birthing people having maternal health outcomes that are worse than their white counterparts. Also, the LGBTQ population has these health disparities as it relates to their health care, whether it be chronic health conditions or just general primary care and follow-up. And a lot of that really goes to the relationship that they've had with healthcare providers and in healthcare systems. So if we don't have a place for us to not only capture their pronouns and call them, you know, by the name that they would like to be called or use the correct pronouns, but also we need to have our technology tell us really what are the anatomy that this person has, so I know how to actually follow up with care. So if there's not an anatomy inventory, how do you know who should get a pregnancy test?
Right.
How do you know, who needs the screening this month on prostate? If you don't have those things there and you're just looking on the surface at a person, that's what gets missed.
Right.
So again, we go back to this, I don't mean to be morbid, but people die. That's what happens when we aren't doing that the right way, the most efficient way. It can be life-changing for people, and people who are LGBTQ plus might not want to engage with us, right? Because they're going to be like, I can't really trust that you even know what you're doing.
No, and trust is really big, as we know in the healthcare industry. We talk about that all the time, especially when it came to just even COVID and the COVID response and you know, getting yourself, you know, whether it's a vaccine or testing. All of those things were primary when it came to conversations about trust in the healthcare system, right? But as we talk about trust, we also talk about, as we talked about earlier, you know, Black maternal rates when it comes to birth, right? And so I know you just talked about you had hired a birth equity coordinator who's an RN, which is huge.
Amazing.
It is huge, right? You don't really hear about that specifically in the healthcare industry. So what was your decision and around hiring someone like that? And was it linked to some of the data that you talked about? Like, what was that process?
Yeah, well, that's great. We actually, before I even joined Kaleida Health, Kaleida was engaged in the New York State Birth Equity Improvement Project. So in that project, they had done research to find out, why do we have these disparate outcomes with Black and brown birthing people? And we say that term birthing people to be inclusive, you know, for the audience who's like, why does she keep saying that? That's just an inclusion term. So, you know, they had done all this research around why those outcomes were that way. And what they found is that, yes, there is definitely some upstream stuff as far as like access to prenatal care. Of course, that needs to improve, and follow up for postpartum care, absolutely. But there was this big, large piece around how Black and brown birthing people felt that the healthcare system interacted with them as it relates to, you know, when I complained or when I said I had pain symptoms, they were not addressed. I don't feel like I was a part of the decision-making process. And so similar to other marginalized communities, when there is that feeling of distrust there and people are feeling, you know, my pain isn't being followed up on, or I don't feel like I have a voice, because typically we think our doctors know the best, right? So we're feeling disempowered in those moments, which could lead to mortality. So many times when people die in childbirth, it's usually in that postpartum phase. It's not actually during childbirth, but it's like they go home and there were these underlying things, hemorrhaging, looking at C-section and, you know, the recovery process for that. There's just so much that goes on in the postpartum period that had not been addressed. And so New York State really pushed health systems and midwife services, all practitioners to engage in some of this anti-racism work in order to bridge the gap between the relationship between the patients and the clinical teams. So with that push, that kind of foundation was already there. When I started, I applied to grants and different things because I knew we would need somebody to do that kind of work. And I felt strongly it should be a person who is clinically trained. Of course, I can go in and I can, you know, I can talk to people and do things. But when they start talking about, you know, CLAPSI and this and that, I can't even tell you what that means. Whereas having a registered nurse on staff, you know, she's able to say, oh, okay, let's see the doctor order. And she can read those things. And she understands that. She knows how to round on patients. She knows how to scrub in. And that's what she does. Her day-to-day is walking around partnering with the maternity units throughout both Oshai and Suburban and really building those relationships and getting people the care that they really want, following up with specifically Black and brown people to say, like, how's it going? How's your stay? And it also gives that patient another person who seems like they're invested and really wanting to know, do you feel like you were discriminated against? And we have surveys that we ask around those things. So really, that was how the decision was made. I ended up getting a grant from the Blue Fund. Shout out. And also a great endowment from First Niagara Key for $1.5 million. And so that funded a lot of the work that we ended up doing around birth equity. It kind of fast-tracked it. So I knew I would hire that role, but I didn't think it would be that soon. But because of some of those efforts that were already out there, it was able to take off.
Awesome.
That is amazing. I mean, it's amazing. And I think, you know, when we think about healthcare outcomes and the connection to so much of the systemic issues that have happened, you know, whether that be historical, current issues, you know, we've talked about in the past about different governors who have come out and said, hey, racism is a public health threat, right? We know that there's issues that come into play when you show up in the doctor's office just being a person of color. And so it's really these type of initiatives that really move the needle and change things over time. There was a hospital system, and I want to say it was in San Antonio, that hired, it was like a VP, or it was a chief medical officer of inclusion, right? So even similar in that concept, people are starting to say, you know what, this has to be a part of the conversation as it relates to healthcare, right? And healthcare improvement, healthcare outcomes. And so just the fact that you're doing that for a specific issue, maternal health, Black maternal health, is amazing, right? And we need more of that. I could see that happening in each section of disease or, you know, chronic illness. That's honestly how we need to be thinking about it and switching those. So kudos to you. Kudos to you on the work that you're doing. It's amazing. It's making a difference.
It is.
And in 2 years.
2 years.
2 years.
You've accomplished a lot in 2 years.
Absolutely.
Thank you.
Yes. So my question is, like, what's next for you in terms of Kaleida? Obviously, you said you're creating this data dashboard, which we know data drives change. And it's the first iteration, so we know it takes time. But what is the first thing that, or the next thing that you think you're going to accomplish within your role, or something that you're seeing that's like, hey, this data shows that we need to make a change in this? What does that look like?
Yeah, that's a good question. Some of that I know the answer to, and a lot of it I don't, right? I think this is a strategic plan in time for us. So we're going to be doing a strategic plan in the next couple months. And it's really in using our data that we want to drive the plan. So we didn't have a dashboard the first time. The first plan I made was for 3 years, and it didn't include a dashboard. It also didn't include the team that I have now. So like to have them a part of that strategic planning process, we want to chart our path forward. I think some gaps, things that we notice that we have to do a better job at is really continuing to communicate. Like, we're just such a big place that even now I can go to Suburban and I'll be walking around and I'll start talking about DE&I, and they're like, we didn't know we had that.
Yeah.
I'm like, what?
Yeah.
You don't know? Like,
Yeah.
I mean, I'm so in it all day that you forget it's 13,000 strong.
Right.
So
Right.
I think we've done a lot in a little bit of time, and it might be a good time to start to just kind of go back a little bit and continue to reintroduce myself, the team, you know, just continuing with town halls. And also when I started, we couldn't gather and those
Right,
sorts
yeah.
of things.
Right.
So like going back to some of that, that kind of community building piece, I think internally it's going to be important, but also externally. So we, with the onboarding of our DE&I manager, she has really taken our ERGs to another level as far as participating in community events and engaging and making sure the foundations are involved. And we need to see that work continue in a deeper way. In a way that really allows our community and our patients to say, okay, you know what, I need to start informing the healthcare system. And that's what we would want. We are reinvigorating next year our patient and family advisory councils. Our nurse, who's the birth equity coordinator, she's starting a maternity advisory board, and that's comprised of BIPOC patients, so Black, Indigenous, people of color. You have to be on this board. And they're going to inform decision making. And then I think a big tool that I know we want to start using, we're working on building an equity impact assessment tool. So we worked with UB to do a literature review to see like what equity impact assessments were already out there. And we came up with what we think ours would look like, and now we need to kind of pilot that. So for next year, I know we'll be piloting on the employee side with our mentorship program, and then we're going to do it with our maternity advisory board on the patient side.
She got the plan. She know what she's doing. She got it together. That's
Right.
really, it's awesome, the work that you're doing. And it's impacting lives, which is really important, right? Especially people of color, you know, people who have been disadvantaged in the healthcare system. So kudos to you on that.
Thank you.
And so, you know, we always got to leave the people. You left a lot of gems in terms of the work that you've already done and what you're doing. But what do you want to leave the people in terms of, you know, your gem of the day? Gem of the day. What you got?
So I wrote it down because I was so excited. So excited to be here. So for the gem of the day, I said, know your values and show up in spaces with the mindset of how is this serving me, right?
Ooh.
I'm not done.
Okay.
Say it one more time.
Right.
I'm
Start
not
from
done.
the top.
I will. Okay. Hey. Okay, know your values. So and I'll just tell a little story. When I first started at Kaleida, they have care values. Be centered around the patient, accountable to patients, respect and integrity, excellence in everything we do. And so I said, well, what are the behaviors that show up around those values?
Absolutely.
I mean, if I'm being accountable to patients, maybe I think not telling them part of their diagnosis is how I'm accountable to them because I'm a caretaker and I think it's the right thing to do. And maybe I tell the patient every single step of the way about their care, and I'm being accountable. So we need to really tell people how to show up around their values. So we have to do that as an organization, but personally, really knowing what are your values and then what are the behaviors under those values. How do you know you're operating in them? And then show up in spaces with the mindset of how is this serving me, right? Your job, your social settings, whatever it is. And then if you realize it's not serving you and you decide you have to stay in that space for financial reasons or whatever the situation is, you're like, you know what, it's not serving me, but I do need to stay here. Just walk in every day with the mindset that I'm choosing to be here. And I know the value that I bring. So
That's deep.
it doesn't need to be so much gratitude.
Yeah.
Okay, listen.
You know, because they should be grateful that you are in the space.
Yes.
And Kendra knows what I'm
I
talking
know
about.
exactly what you're talking about. Yes.
Yeah.
So we have to show up and show out and own our space that we're in. We talk about it all the time.
All the time.
So where can people find you? We always talk about LinkedIn or whatever you want to share. If people want to get in contact with you, if they have questions, where can they find you?
Yeah, LinkedIn would be the best way, or you could check out the Kaleida Health website.
Yes.
Send me an email through that. And those are really the only social handles that I really use. So.
Yeah. Awesome.
Yeah.
Well, Shannon,
Yes, thank you.
we appreciate you. Thank you for everything that you're
you.
doing, the
I
differences that you're
appreciate
making.
you.
Yes.
And thanks for coming on. We've been talking about it for a while, so
I
it's
know.
awesome
I'm
to
glad we
have you-
did it.
Yeah.
Have you
Yes.
on for sure.
Yeah. Thank you,
Awesome.
ladies. Thanks for everything.
Of course, thank you. All right.
What's
So,
this?
end of episode 2, season
Episode 2.
4, and we're out.
We're out. Peace.
Peace.